Hi, I'm Amy Mooney. I'm an occupational therapist and I work with individuals who have chronic long-term illnesses that involve post-exertional malaise.
Hi, I'm Clayton Powers. I'm a doctor of physical therapy specializing in long COVID and ME/CFS, and I love helping individuals who have struggled to find help in the healthcare system. A common symptom of long COVID is post-exertional malaise or post-exertional symptom exacerbation. If you're a patient listening to this and you have noticed that your symptoms worsen after exercise or activity, and it lasts for 2 to 3 days or more, then you have experienced post exertional malaise. Post exertional malaise, or PEM, is a worsening of your symptoms and function that is usually delayed 24 to 72 hours after activity or exertion, like having a conversation, going to the store, working, exercising, or other activities can trigger this worsening of symptoms. It is not a functional neurologic disorder or conversion disorder. It's not laziness or deconditioning. There are physiologic causes to your symptoms. PEM is caused because of an issue in how the body makes energy and responds to stressors. Research has shown that during PEM, individuals have increased inflammation and often feel like they're getting sick. Imagine that your cell phone got a virus that caused it to only charge to 30% when you plugged it in all night. You'd have to prioritize which apps you're going to use during the day. When you start to do activities, your battery drains faster and needs to be charged more frequently. The goal is to reduce the number of post-exertional malaise episodes that you experience to help you to learn how to recharge your battery faster during the day and to provide you with the tools for managing your condition. Another symptom, a common symptom of long COVID, is orthostatic intolerance. Research has shown that many individuals with long COVID don't get enough blood flow back to the head when they're in upright positions like sitting, standing, or walking. One way to recharge your body's battery and improve your symptoms is to frequently do activities that move blood back to your head during the day. This can include putting your legs up frequently throughout the day when you feel lightheaded, fatigued, or dizzy. It can also be helpful to wear compression socks, leggings, or an abdominal binder to push blood back to your head. Drinking more electrolytes and fluids during the day may also help if approved by your medical provider. Managing this lack of blood flow to the head can make a significant difference in your symptoms and function. Those who have orthostatic intolerance without post-exertional malaise find that exercising in recumbent or lying down positions can be helpful. But for those who have post-exertional malaise, activity pacing is more beneficial.
So many of you have likely heard from therapists and doctors and probably many, many others that the key to managing ME and long COVID with post-exertional symptom exacerbation is to learn to pace. And it is frustrating because there's no magic pill or quick fix. And pacing feels so vague and relentless. You've already sacrificed so much for your daily life, things you've enjoyed, even your aspirations. What more is there to give up? Pacing, in reality, is about prioritizing meaningful and purposeful activity and finding ways to engage in those activities more effectively with fewer symptom exacerbations or consequences. Pacing involves doing more things more efficiently or better. It involves carefully assessing how different activity stressors affect your symptoms and adjusting your engagement accordingly, whether it's physical, cognitive, social, emotional, or sensory stressors. For someone dealing with the hallmark symptoms of ME, post-exertional malaise or PEM, even a small amount of predictability or control can make the world of difference. If an individual can assess their symptoms, prioritize meaningful activity, plan how they will do it best supported for performing this activity, they are able to pace their engagement in the activity with attention to the stop signs or the cues for not exceeding the threshold. This pacing for PEM approach involves recognizing immediate and delayed symptoms, analyzing activities within the limitations of PEM, and integrating preemptive and recuperative rest strategies so that meaningful activity can be performed with the least amount of consequences possible. Pacing for PEM requires a deep understanding of how specific activity triggers the symptoms and analyzing individuals' responses. For instance, physical exertion may manifest symptoms like raising your heart rate or having sore lymph nodes or even dizziness or lightheadedness. Cognitive exertion may lead to headaches or word find issues or even coat hanger pains in the neck and the shoulders. Social emotional, for example, could result in symptoms like ringing in your ears or breathing difficulties or trouble following conversations. By identifying these stop signs and discerning patterns, individuals can gauge their current activity tolerance and make informed decisions about engaging in meaningful tasks. What do you want to do? What is meaningful to your life with minimal consequences? And then implementation of accommodations and modifications, which would serve as tools to reduce exertion and minimize the impact of these stressors on your symptoms in your everyday life. Pacing for PEM represents a paradigm shift, emphasizing an individual's lived experience and describing the consequences of these activities. This approach involves recognizing immediate and delayed symptoms, analyzing activities within the limitations of PEM, and integrating preemptive and recuperative rest or radical rest with the focused goal on improving your quality of life.
To the clinicians who are listening to this, please reach out to your physical therapists, occupational therapists, and speech therapists and encourage them to learn more about post-exertional malaise, orthostatic intolerance, and the other complexities of long COVID and ME/CFS so that we can provide better care to these individuals.
For more information on pacing for PEM strategies, please go to the Bateman Horne Center's website for medical provider and patient support videos and resources.